everyone, and welcome to another episode of Infectious Conversations. This is WVU Medicine's Infectious Diseases podcast, and this is a very monumental episode for us because it's the first time that we have video. So historically, we've always been an audio podcast, but now we have video, so that's awesome. This is our third year of doing these podcasts, and my name is Dr. Meera Mehta. I am the host of today's episode. I'm a clinical infectious diseases pharmacy specialist, and I've been working at Ruby Memorial Hospital for approximately 8 years now. Now, today we have a very special guest with us, Dr. Courtney Bunner. Courtney, if you want to introduce your title and how long you've been working at WVU Medicine, as well as a fun fact about yourself.
Yeah, my name's Courtney. I'm a clinical pharmacy specialist in infectious diseases, and I just started here at WVU Medicine in August of 2024 after finishing my residency in infectious diseases in July. I'm happy to be here. And I guess a fun fact about myself would be that I'm a baker on the side, and sometimes I bake for other people, and I made my sister's wedding cake.
Oh, wow, that's amazing.
Yeah.
That's really cool. Are you a fan of the Great British Bake Off?
Yes, I love it. I watch every season.
It's a great show. Well, Courtney, today we're here to talk about H5N1 or the bird flu. And I feel like when it comes to respiratory viruses, we're always hearing about something, whether it's influenza, whether it's COVID or RSV. Courtney, can you tell us a little bit about the bird flu and what makes it different from seasonal influenza?
Yeah, so the bird flu, which I'll refer to it as the rest of this session because it's easier to say than H5N1, but it's the avian influenza. It stems from wild birds mostly, and then it can also affect dairy cattle and then other wild animals as well, but mostly wild birds, poultry, and dairy cattle. The main differences between the regular flu and the bird flu are that they're the hosts, so coming from mainly wild birds or poultry, like I said. Prevention of the seasonal flu exists with the annual flu vaccine. And then unfortunately, we don't have a widely available vaccine for the bird flu quite yet. And then the impact on health is pretty much the same with seasonal flu and the bird flu. But the bird flu can be a little bit more serious and have a higher mortality and morbidity rate compared to the seasonal flu. But we see the same type of respiratory symptoms like upper respiratory tract infections, but we can also see it go to multi-system organ failure as well. But it's a lot less common than the seasonal flu. We see a lot more annual cases of the seasonal flu than we do in the bird flu.
Right.
But there has been an outbreak in the past year as of March of 2024 with an increased amount of cases in the United States, mainly seen in dairy cattle, mainly in the California area, and then there was most recently a case in New Jersey.
Okay.
Since March of 2024, we've seen about 67 human cases, mainly coming from those dairy cattle in California.
Okay, yeah, that's really interesting because I was reading about this and it appears that there's almost 150 million birds that have been affected with the bird flu. But as you were saying, in the US since 2024, there's been about 67 cases with one death who was in an individual who was above 65. So it appears that this is predominantly is affecting birds. So why should humans be concerned?
Yeah, so the higher morbidity and mortality rate makes it a little bit concerning, and the outbreak that has occurred in the past year in the United States. Mainly, we only really are concerned about exposure when people work directly with either dairy cattle or poultry. So we can see it in people who have occupations in more farm settings or poultry settings. But we want to kind of stop the outbreak if we can. So being aware of the symptoms and the risk of exposure is really important in order to seek out the appropriate testing that we need and then treat the patients that have the bird flu.
Right. That's excellent information. And the bird flu, it typically spreads very rapidly between poultry. As you mentioned, it can affect other animals as well. So I've heard that it can affect cats, domestic cats, for example. There's been some cases there. Cattle, as you mentioned, even marine life, so otters as well, which I thought was really, really quite interesting.
Yeah.
The spread from animals to humans is a little bit less, it has a lower propensity of spreading. And that's because of the antigens on the virus. Our receptors in humans, they aren't the best for acquiring that transmission from those antigens. So typically there's not much evidence of spread from human to human at this point, but there can be spread from animals or poultry or dairy cattle to humans, and so that is the concern. Now, one of the things that we've learned about respiratory viruses, especially from COVID, is that viruses do have the ability to mutate, and so this bird flu, there is the propensity for it to mutate, and if all of the right mutations take place, potentially there could one day be transmission from human to human, but currently we're not at that point yet.
Right.
Okay.
Yes.
And well, you talked a little bit about the signs and symptoms. I was also reading that conjunctivitis was an interesting sign or symptom of the bird flu. So let's say if we have a patient and they start to have some of these signs and symptoms of the flu, there's a lot of overlap between other respiratory viruses and symptoms and bird flu symptoms. But let's say somebody may have these symptoms, or maybe a clinician may have a patient in clinic that has these symptoms. How do we help determine whether it's the bird flu or might be something else?
There is a lot of overlap, like you said, of the symptoms of the regular flu or other respiratory viruses like COVID. So it is hard to determine, but I think interviewing the patient and seeing what their exposures are like is really important to pin down whether we need to test them for the bird flu or not. So high risk of exposure for bird flu include working directly with either poultry, wild birds, dairy cattle, these animals that could be affected by the bird flu. Mainly, the bird flu is contracted by being in direct contact with either feces or the saliva, mucus, or having direct contact with like dead animals you might work with on a farm or what have you. So interviewing the patient and seeing what their exposures are like through their occupation, their day-to-day activities, if they've recently visited a wild bird aviary or something like that, is really important to determine if we need to be testing them or not. If they've had no exposures, then most likely we can just test them for a regular respiratory viral panel, but knowing what the patient does on a day-to-day basis and what their exposures are to the bird flu is important to determine if we need to test them.
And if they do end up having the bird flu, are there any treatment options or even prophylaxis options for people who may have been exposed?
Yeah, so it's the same antiviral that we use for the seasonal flu called oseltamivir or Tamiflu. The dosing that we use is similar, 75 milligrams twice a day for 5 days for treatment of the bird flu if we highly suspect it or it's probable. If they're outpatients and they're stable or hospitalized patients and they're stable, then we use this dosing. But there is an option to use a combination antiviral therapy if the patients are really sick or they're immunocompromised and they have a high risk of progression of disease. We can look at other options to use combination antiviral therapy, and we can even extend the duration of the oseltamivir to 10 days versus 5 days, but there's really not that much data in extending the duration. we just kind of try to hope that using the longer duration could benefit the patient if they're at high risk of progression.
Definitely. It seems quite promising that there is a treatment option available if somebody does contract the bird flu, and it's something that we already have experience with as well.
Yeah.
So Courtney, finally, could you touch on some good prevention strategies? How can we mitigate being exposed and contracting the bird flu?
Yeah, so if someone does have an occupation or on a day-to-day basis is exposed through poultry or cattle or other animals, it's important to use the appropriate personal protective equipment or PPE. All of these stipulations are listed on the CDC website based on how you handle or what type of animals you're coming into contact with. So it can be easily found on those websites, whether you need to use a respirator or gloves, a gown, hair cap, boots, and things like that in order to appropriately protect yourself when you're coming into contact with these animals to prevent transmission through their feces, saliva, or mucus if you could be exposed. And if you are in a household where maybe your spouse is working in an occupation that has exposures like this and they get sick, it's important to let the doctor know so you can get tested. And then if they are experiencing symptoms or you are experiencing symptoms, you should isolate yourself for 10 days.
Yeah, so very, very good prevention strategies there on how to protect ourselves from the bird flu. Even though there has been an uptick of cases, it looks like there are ways that we can help protect ourselves.
Another thing I forgot to mention that's important to be aware of is we should really stay away from unpasteurized dairy products, including raw milk, because that can be a link to exposure to the bird flu as well. The pasteurization of dairy products kind of gets rid of the viruses that could be contracted via consuming these products.
Right.
So that's another thing. And then consuming, if we're going to consume either cattle or poultry, it's always important to make sure that we're consuming appropriately cooked meat as well. There's certain temperatures that need to be achieved whenever cooking these meats, so it's very important to be aware of those temperatures that you need to be cooking the meat to in order to prevent exposure through consuming those meats.
And I feel like that's very good practice in general. There are a lot of, besides bird flu, there are a lot of foodborne illnesses as well that people can contract. So in order to just prevent the whole gamut of infectious diseases that can happen, it's important to follow those practices. Courtney, do you have any final thoughts about the bird flu at all?
No, I mean, overall, it's from bird to human, it's a low rate of transmission, but it's always important to be aware of where there's outbreaks and be aware of if you're in an area of an outbreak and if you have symptoms, to make your healthcare provider aware that you might have been exposed to the bird flu. But yeah, that's mainly it.
Well, thank you so much, Courtney. I really appreciate your time today and helping us all learn more about the bird flu. That concludes today's episode of Infectious Conversations. I am your host, Dr. Meera Mehta, and our guest today was Dr. Courtney Bunner. We hope that you tune in to our next episode of Infectious Conversations. Thank you.